So today, we're going to dive into a really powerful class of medication that's been a key player in mental health for, wow, over 60 years. Tricyclic antidepressants, or TCAs for short. But here's the thing, their power comes with a pretty complex trade-off, and we're going to break down exactly what that means for you.
For so many people, modern antidepressants are just life-changing. But what do you do when those go-to first-line treatments just don't cut it? Well, it's right there in that really tough question where the story of TCAs gets interesting.
To really get a handle on TCAs, we kind of have to jump in a time machine. See, these came from a totally different era of medicine, one that actually paved the way for a lot of the treatments we rely on today. TCAs first hit the scene way back in 1959, and for almost 30 years, they were one of the main weapons doctors had against major depression. It wasn't until the late 80s that SSRIs, you probably know them by names like Prozac, showed up and became the new standard of care.
And this right here really gets to the heart of it. When you look at pure effectiveness, study after study shows TCAs work just as well as the newer SSRIs. The huge difference, the core trade-off, is that they come with way more side effects, and that is the #1 reason they're not the first thing a doctor reaches for anymore.
Okay, so how do these things actually work inside our brains? It sounds super complex, I know, but the main idea behind it is surprisingly straightforward.
It all kicks off with something called a neurotransmitter. Now just think of these as the brain's tiny mood messengers. Chemicals like serotonin and norepinephrine, they carry signals between brain cells, and they are absolutely crucial for regulating how we feel.
So here's how it all goes down. Your brain is constantly sending out these mood messages. Now, normally, once that message gets delivered, the brain has this little cleanup crew that swoops in and clears them away. What TCAs do is they basically block that cleanup crew. By stopping them from reabsorbing the messengers, they leave more of those good, mood-boosting chemicals hanging around for longer, which can really help lift a person's mood.
So that leads to a really big question, right? If TCAs have more side effects, why on earth are they still prescribed at all? Well, the answer is that their use today is very, very specific.
TCAs are often seen as a powerful second-line defense, especially for major depression when nothing else has worked. But their usefulness doesn't stop there. It turns out they're also prescribed for chronic pain conditions like fibromyalgia, for insomnia, OCD, and even for bedwetting. They're kind of a versatile, if tricky, tool in the toolbox.
All right, now we have to talk about the other side of the coin, the calculated risk part of this whole thing. The reason TCAs aren't a first-line treatment comes down to their pretty significant list of side effects.
Let's start with the stuff you're most likely to run into. Now, these aren't usually life-threatening, but man, they can be really bothersome. We're talking dry mouth, drowsiness, dizziness, weight gain. These are often annoying enough that people just stop taking the medication altogether.
And the risks don't stop there. There are also some less common, but much more severe potential effects. An irregular heartbeat is a huge concern because it can actually be life-threatening. Others include things like confusion, seizures, and fainting. This is exactly why a doctor has to monitor you so carefully.
And this is probably the most critical point of all. Unlike a lot of the newer antidepressants, high levels of TCAs are actually toxic. An overdose can be fatal. This is not a medication you can mess around with. It is absolutely vital to take it exactly as your doctor prescribes.
There is also an official FDA black box warning. This is the most serious warning they can put on a drug, and it applies to all antidepressants, including TCAs. It warns about an increased risk of suicidal thoughts and behaviors, especially in people 24 years old and younger. That risk is at its highest during the first few weeks or right after a dose change, which again is why close monitoring is so important.
So, on top of the side effects of the drug itself, there are some really crucial warnings about how TCAs can interact with other things, like other drugs or even health conditions you might already have.
One of the absolute biggest risks is a condition called Serotonin Syndrome. You really need to know about this one. It's a true medical emergency, and it's caused by dangerously high levels of serotonin in the brain, usually from mixing medications. And yes, it can be life-threatening. This is exactly why you have to be 100% honest with your doctor about every single thing you take. TCAs can have dangerous interactions with other antidepressants like MAOIs and SSRIs, the herbal supplement St. John's wort, certain pain relievers, and even alcohol. These are the kinds of combinations that can set off that serotonin syndrome we just talked about. And it's not just about other drugs. Your own medical history is a huge piece of the puzzle. If you have any of these pre-existing conditions, especially something like a heart condition, a history of seizures, or liver disease, TCAs can cause some really serious complications. This is a must-have conversation with your doctor.
Okay, so let's bring it all together. We've gone through the history, the science, the uses, and all those significant risks. So what's the bottom line here?
Here it is. TCAs are a really powerful tool for sure, but they are almost never a doctor's first choice. Their effectiveness is matched by their risks, and that means using them requires careful professional management and a completely open, honest conversation between you and your doctor.
At the end of the day, picking a medication isn't a one-size-fits-all deal. It's a personal calculation. Your lifestyle, your age, your entire medical history. All of it plays a huge role in figuring out if a drug like a TCA is the right move for you.
Which leaves us with this one last big question that really wraps up this whole dilemma. Is an older drug, one with bigger risks, ever the right choice in today's world? And you know what? For some people, under just the right circumstances, especially when other treatments have failed and they have a doctor watching them closely, the answer is absolutely yes. It's a complex decision, one made between you and a healthcare professional. And being armed with this knowledge is the first and most important step you can take in having that conversation.